Welcome to another deep dive. Today, we are going to be dissecting a research article,
Okay.
and the title is a mouthful. It's called Prognostic Value of Clinicopathological Parameters
Okay.
Assessed During Admission of Foals with Neonatal Encephalopathy
All right.
and Comorbidities Developed During Hospitalization.
Oh, wow.
So get ready to
Yeah.
put your neurologist hat on,
Okay.
because we're about to uncover some really fascinating insights about predicting survival
Cool.
in foals that have been diagnosed with NE.
Yeah, this is a really critical area of research, especially given how complex NE is and the desire to provide the best possible care for these patients.
Absolutely.
Yeah.
And the study uses a retrospective design,
Okay.
analyzing medical records of 61 foals
Got it.
diagnosed with NE.
Mm-hmm.
And this was over a span of 20 years.
Wow.
20 years worth of data.
Yeah, the researchers were really interested in finding those factors that are measurable right when those foals are admitted. That could give us clues about their likelihood of survival.
Exactly. And they found that the overall survival rate was 57.4%.
Okay.
Which the paper points out is a bit lower than some other reports.
Yeah, and I think that that difference probably stems from the fact that this study specifically included foals who developed complications during their time in hospital,
Oh.
which obviously makes their recovery
Yeah.
even more challenging.
So let's jump right into some of these factors that emerged
Okay.
as significant predictors of survival.
All right.
The study found that foals that presented recumbent at admission had a significantly higher risk of dying.
Yeah, the odds of mortality were like 6.84 times greater for recumbent foals compared to those who were able to stand. And I think that makes sense because recumbency often indicates a more severe neurological dysfunction.
Right.
So it's a critical red flag.
Makes sense. What about those all-important vital signs?
Yeah.
Were there any that stood out as particularly predictive?
Hypothermia was another strong predictor.
Okay.
So foals with a low body temperature at admission had a 4.85 times higher risk of mortality.
Wow.
So maintaining a normal temperature in these fragile neonates is really important.
And what about blood glucose levels?
Yeah.
We know those can be tricky in neonates.
Absolutely. The study found that hypoglycemia was a significant risk factor, with foals presenting with low blood glucose having a 6.67 times greater risk of not surviving.
Wow, that's a striking difference.
Yeah.
Did any of the lab values from the blood work jump out?
Yeah, hypercreatinemia or elevated creatinine levels was another red flag.
Oh.
Foals with that. At admission had a 6.67 times greater risk of mortality.
Wow.
So it really highlights the importance of looking at kidney function early on.
So we've got recumbency, hypothermia, hypoglycemia, and hypercreatinemia all kind of emerging as strong predictors of a less favorable outcome.
Right.
Were there any other factors that, while less common, still significantly impacted survival?
Yeah. Anemia was linked to a 4.95 times greater risk of mortality, despite only being present in about 13% of the foals.
Okay.
So ensuring adequate oxygen carrying capacity is really essential in these patients.
And the study also points out that some commonly measured parameters, like heart rate, respiratory rate, total protein, and BUN, weren't found to be statistically significant predictors of survival.
And that's important because it highlights that we need more research to clarify the value of these parameters in foals with NE.
Okay.
It's not just about measuring everything. It's about identifying those measurements that provide the most valuable information.
So now, in addition to these factors that are present at admission, the study also looked at the impact of complications that developed during hospitalization.
Yeah, and what they found was quite striking. The presence of any comorbidity, any additional health problem that arose during the Foals hospital, dramatically increased the odds of mortality.
How much of an increase are we talking about here?
We're talking a 40.1 times greater risk of dying.
Oh my goodness.
Compared to those who didn't experience any additional health issues.
Oh, wow.
It really emphasizes that we need to be proactive about management and supportive care.
Were there any specific complications that were particularly concerning?
Pneumonia,
Oh.
a common issue in foals, was linked to a 5.14 times greater risk of death.
So respiratory health is a top priority.
Yeah.
In these cases.
For sure.
What about other complications like sepsis?
Septicemia, although it was less frequent in the study, had a 100% mortality rate.
Oh, wow.
Which really emphasizes the need for strict infection control protocols in veterinary hospitals.
Makes you think about all the potential sources of infection in a hospital environment and the importance of minimizing those risks.
Absolutely. And the authors of the paper suggest that the relatively low number of sepsis cases might be because of early intervention.
Okay.
And the fact that none of the foals had complete failure of passive transfer immunity.
Right.
Which we know can really weaken their immune systems.
Yeah, that's a really good point.
Yeah.
Ensuring adequate colostrum intake, either from the mare or through supplementation, is crucial for those foals that might be at risk.
Yeah. It all ties back to providing the best possible supportive care right from the start to really give them the best chance of fighting off any infections.
Okay, so we've covered a lot of ground here.
We have.
From those initial factors present at admission to the significant impact of complications that can develop during hospitalization.
Yeah, it's complex, but these findings give us valuable insight into the factors that influence survival in foals with NE, which can help guide our clinical decision-making.
This is where it gets really interesting.
Yeah.
What implications do these findings have for our approach to treating and managing these cases?
That's the crux of the matter.
Okay.
It highlights the importance of recognizing those risk factors early on and intervening promptly and aggressively.
So we've been talking about the importance of early recognition and intervention, but what does that actually look like in practice?
It starts with a good neurological exam. To confirm that the foal does have NE and figure out how severe their neurological dysfunction is.
Okay.
We also need to pay close attention to those parameters we've been talking about.
Right.
Like temperature, blood glucose, and creatinine levels.
And if we see any of those red flags, what are the immediate steps?
Well, adjusting hypothermia is really important.
Okay.
We need to warm that foal up gently and effectively.
Okay.
We can use warming blankets, warm water bottles.
Okay.
Or even a warm air incubator if necessary.
The paper mentioned that foals have really limited glycogen stores.
Right.
Making them especially vulnerable to hypoglycemia.
Yeah.
So how do we manage that?
Nutritional support is key, and it needs to be started early and it needs to be frequent.
Okay.
If the foal can nurse effectively, that's ideal. But if they can't, we might need to give them some extra nutrition through a nasogastric tube or intravenous fluids with dextrose.
So we're stabilizing those vital parameters.
Right.
What about addressing the underlying neurological dysfunction?
That's where things get a little more complicated.
Okay.
And the treatment approach really depends on what we think is causing the NE.
The study mentioned hypoxia-ischemia during birth as a major contributor.
Right.
So what are the treatment options in those cases?
Well, if we think it's hypoxia-ischemia, we might consider therapies aimed at reducing brain swelling and inflammation.
Okay.
Things like hyperbaric oxygen therapy or anti-inflammatory medications.
What about those cases where infection or inflammation is suspected?
Yeah, in those cases, antimicrobial therapy and anti-inflammatories are really important.
Okay.
We can do blood cultures to try to figure out the specific bacteria and make sure we are using the right antibiotics.
The study also highlights the importance of monitoring for and managing those complications. Right. That can arise during hospitalization.
Yeah.
So what are the key things we need to be looking out for?
Respiratory health is so important.
Okay.
We need to be listening to those lungs regularly, watching for any signs of difficulty breathing.
Right.
And we really want to take steps to try and prevent pneumonia.
Okay.
Like good hygiene.
Yeah.
And if they need it, providing respiratory support.
The study found that all the foals who developed sepsis died.
Yeah.
That's pretty scary.
Right.
What are some of the early warning signs of sepsis?
So changes in those vital signs, like an increased heart rate or respiratory rate, can be an early clue.
Okay.
We also need to watch for any fever, lethargy, or changes in behavior.
Okay.
And if we think it might be sepsis, blood cultures are essential.
Okay.
So we can get them on the right treatment.
It sounds like it's a tough balancing act.
Yeah.
Between providing supportive care and really aggressively addressing any complications.
It is. We're walking that tightrope.
Yeah.
And constantly assessing how the foal is doing.
Right.
Adjusting the treatment plan as we need to. And just doing everything we can to help them recover.
The study also mentioned some limitations.
Yes.
Including the fact that it was retrospective and that the medical records came from over 2 decades.
Right.
How might those limitations affect how we think about the findings?
You're right. Those are really important points.
Yeah.
Retrospective studies like this one are limited by how good the medical records are.
Right.
And if they are complete.
Yeah.
And with data coming from 20 years, you know, it's very possible that the way they diagnosed and treated these foals changed over time, which could have affected the results.
So it's great information, but we need to remember those limitations.
Exactly. It's not a perfect picture, but it's a good starting point. And we need more research, especially studies that are designed from the beginning to look at these prognostic factors in foals with NE to make sure these findings are accurate and to learn even more about what factors are important.
This research found that some things they measured routinely weren't actually predictive of survival.
Right.
Do you think that could change with more research?
For sure. It's possible that with more foals in a study or a different study design, we might find that some of those things like heart rate or respiratory rate do matter.
This research focused on clinical parameters. That are measurable pretty much anywhere. What are the implications of that?
It means that vets can get a lot of information about a foal's prognosis just by paying attention to those easy-to-get measurements, even without special equipment.
That's pretty empowering.
It is.
What if we could take that even a step further? And develop some kind of standardized prognostic scoring system?
That would be great.
For
foals with NE.
What would that look like?
Well, I imagine we'd have a system that looks at those key clinical parameters we talked about. Things like recumbency, hypothermia, hypoglycemia, hypercreatinemia, and anemia. Maybe giving points based on how bad each factor is. Then vets could use that score to objectively determine how risky things are for that foal. And make good decisions about treatment and management.
It would also give us a more consistent way to communicate with owners.
Absolutely.
To help them understand what's going on. And what challenges they might face.
Exactly. And it would let us track how things change over time and maybe even identify new risk factors or better understand the ones we already know about.
So we got all those things we can measure right when the foal comes in. But the study really emphasizes that things can change quickly and complications can happen.
Absolutely.
So how do we account for that?
That's where carefully monitoring them over time comes in. We can't just rely on those initial measurements. We have to keep checking on the foal regularly. And watching for any little changes that might be a sign of a new problem developing.
It sounds like a continuous process.
It is.
Of evaluation and adjustment.
Exactly. And it highlights how important it is to have clear communication and collaboration between the veterinary team, the owners, and anyone else who's involved in the foal's care.
We've got to share information. Discuss what we're worried about.
Absolutely.
And make decisions together. This research also raises questions about what happens later on for these foals. Even if a foal survives, NE. Could there be lasting effects?
That's another area where we need more research. We need to follow these foals long term. See how their nervous system develops and watch for any signs of problems with thinking or behavior.
It really makes you think about how important it is to take a holistic approach to their care.
I agree.
It's not just about survival. It's about quality of life, too.
Exactly. We need to think about the foal's future, not just the crisis they're facing right now.
It's incredible how much we can learn from a single research article.
I know.
It feels like it's opened up a whole new world of possibilities for how we can take care of these foals.
And what I find really fascinating is that it emphasizes how important those simple and readily available measurements are. You know, things like checking their temperature and doing a quick blood glucose test. Those basic tools can really have a huge impact on how we manage these cases.
That's a great message for vets out there.
It is.
You don't need fancy technology to make a difference.
That's right. It's about being observant. Recognizing those subtle signs and acting quickly.
This research seems like it opens up all kinds of possibilities. If we can identify those risk factors early, do you think we could develop interventions to maybe make those less impactful and improve survival rates?
That's the burning question. Like, imagine if we could come up with specific treatments for hypothermia or hypoglycemia that were more effective.
Or find ways to help the foal's immune system work better. So they're less likely to get sepsis.
That would be amazing.
It really could change everything.
But to get there, we need more research.
Yeah, for sure.
What are some of the areas where we really need to dig in and learn more?
Well, one thing is we need to understand how those clinical parameters are actually linked to mortality. Like, why is being cold so bad for these foals? What exactly happens when their blood sugar is too low that causes damage to the brain? If we can answer those questions, it could help us develop treatments that are more targeted and work better.
And the study also highlights the need for more research on prognostic indicators in foals with NE.
Right.
We've talked about maybe having some sort of standardized system for predicting how a foal will do. What do you think that would look like?
I think it could be really helpful.
Yeah.
And what impact could it have? Well, we could create a system that takes into account all those important clinical things we talked about.
Recumbency, hypothermia, hypoglycemia, hypercreatinemia, anemia.
Yeah.
Maybe give each one a certain number of points based on how severe it is.
Right.
So vets could use that score to figure out the foal's risk level and adjust their treatment plan based on that.
And it would give us a way to communicate with owners that is more consistent.
Exactly.
So they really understand the prognosis and what challenges might be ahead.
And it would also help us track how things change over time and maybe even find new risk factors or better understand the ones we already know.
So we've got those things we can measure when the foal first gets to the hospital.
Right.
But the study also points out that things can change really fast.
Yeah.
And complications can pop up.
They absolutely can.
So how do we take that into account when we're trying to figure out how a foal will do?
We have to monitor them over time.
Okay.
Can't just rely on those first measurements.
Right.
We need to keep checking on them.
Yeah.
And watch for any little changes that might mean a new problem is developing.
So it's kind of a constant process.
It is.
Of checking and adjusting.
Exactly. And that's why communication is so important. Everyone involved in the foal's care needs to be talking to each other.
Yeah. Vets, owners, anyone else.
Right.
Sharing information.
Yes.
Talking about what we're worried about.
Absolutely.
And making decisions together. This research also got me thinking about the long-term effects of NE.
Yeah.
Even if a foal survives, are there things that could still affect them down the road?
That's a great question. And another area where we need more research.
Okay.
We need to follow these foals as they grow, see how their brains develop, and look for any subtle signs that they might have problems with thinking or behavior.
So it really emphasizes that we need to be thinking about the whole picture.
I agree.
Not just getting them through the initial crisis,
right,
but making sure they have a good quality of life.
Absolutely. We need to be thinking about that foal's future.
This has been a fascinating deep dive into NE.
It has.
There's still a lot we don't know.
Yeah, but this study gives us a good place to start.
Yeah.
And it highlights those key factors that influence whether a foal survives. It emphasizes how important it is to recognize those factors early and act quickly.
Right.
And it shows us that we need more research to really understand this complex condition.
So as we wrap up, what's the one thing you want our listeners to remember from our conversation today?
I'd say the biggest takeaway is to be vigilant.
Okay.
Pay close attention to those things we can measure. Intervene early and aggressively when you need to.
Right.
And never underestimate the importance of good supportive care.
Those are great words to end on.
We can make a real difference for these foals.
From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.